In this short video, I'm going to explain to veterans what a VA lay statement is, the importance of it, what should be documented on it so they get rated appropriately. This is something that at Vet Comp and Penn, we know the importance of a VA lay statement to make sure that our veterans get the rating that they truly medically qualify for. VA lay statements are underrated and undervalued and underutilized by veterans, and frequently it results in not getting the benefits that you truly deserve. Don't let this happen to you. If you rely solely on a C&P examination to evaluate your disability and document all of your symptoms and the severity of your symptoms, you may not be getting the disability benefits that you truly deserve. This is just a reality. A VA C&P examiner might have 10 minutes to do your exam and document all of your symptoms and fill out a 12-page disability benefits questionnaire. They just don't have time to query you about all of your symptoms and the severity of your symptoms, so they may not ask you the questions that they need to. They're only viewing your disability at a brief point in time. They don't follow you around to see how it affects your life. They don't see you on your worst day frequently, unless your worst day is during your exam, which is highly unlikely. So your chance to tell your story is a VA lay statement, a statement in support of claim. You should document it on a 21-4138 form. You should tell the story of your disability in chronological order. You can even use bullet points. Describe your first symptoms, when you experienced them, your diagnosis, when you were diagnosed, any treatment prescribed by a provider, any treatment self-prescribed, over-the-counter medications for symptoms, how it affects your daily life, how it causes a loss of function for you. If you're not able to participate in activities that you would normally do, you need to make sure to document that. Here's an example. GERD, gastroesophageal reflux disease. Many veterans suffer from this, and many veterans are rated and service-connected for GERD. But most veterans that I see when I ask them questions about all of their symptoms are underrated for this condition. This is simply because all of their symptoms and the severity of their symptoms is not captured in their C&P exam. They might have trouble laying down because of reflux. They can't eat certain things. They have pain in their chest as well as their arm. They burp up gastric juices that cause a sour taste in their mouth. All of these things are very frequently not documented in their C&P examination, but they directly derive the rating. They drive the rating. Make sure that you document all of those symptoms on your VA lay statement. For any VA disability claim, whether it's a new claim for benefits or whether it's a claim for an increase in a current service-connected condition, you have to, as a veteran, ensure that you get the benefits that you medically qualify for by documenting all of those symptoms on a lay statement. There's only one other form, a VA Stressor form, to document your subjective experience. The only time you should use that form is when you are documenting a traumatic event that happened on active duty service that may have caused a chronic mental health condition. I'll have other videos about 21-0781 VA Stressor forms, but for this video, I'm only explaining the 21-4138 form, or the statement in support of claim. At Vet Comp and Penn Medical Consulting, we know the value of a VA lay statement. I recommend ProHelp. Please look us up. If you want to do it on your own, make sure to include all of the things that I described in this video. Good luck. Thank you.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss individual circumstances in all cases.